Well, the White House is now debating whether to declare a public health emergency for monkeypox, but officials say data shortfalls are hindering mitigation efforts right now. The U.S. has just recorded under 3,000 cases of monkeypox. The CDC director, Rochelle Walensky, says her agency has no data on who's been vaccinated for monkeypox and does not have the authority to collect that data or to mandate it. Janet Hamilton, executive director of the Council of State and Territorial Epidemiologists, says, quote, "It's a new and really fast-moving outbreak, and there have been some challenges around having a smooth and efficient way for the data to be sent from jurisdiction." So let's talk about all of this with Health and Human Services Secretary Xavier Becerra. He joins me now. Secretary Becerra, thank you for your time, and let's begin with this. On a scale of 1 to 10, how concerned are you about the spread of monkeypox in the U.S.? Are you more concerned than a year ago?
Well,
a month
probably
ago, not a year ago, a month ago.
A day ago. We should
ago.
Absolutely be concerned, 100% concerned, because we've not had monkeypox the way we've seen it now, and we don't want it to become a part of life the way we're seeing. And so we have to stay ahead of it, and that's what we've been trying to do since day one. We have now increased the number of vaccines that we have available. As you mentioned, we've got about some 3,000 cases that have been reported. We suspect there's several, much more than that, but we've got about 300,000 plus vaccines that we've now made available throughout the country.
Well, two points you just made. Well, first of all, on a scale of 1 to 10, how concerned are you today?
Concerned, look, always concerned with something that's coming that we have not had to deal with before, so 10. But
10?
Yeah, because we want to get ahead of it. You don't want it to become a part of life. But how many people have died compared to, say, COVID? Zero.
I understand that, but it's a major concern for those people affected and those people exposed. You said we suspect many more cases than the roughly 3,000 now reported. How many multiples are you talking about?
That's what's tough, is we need the states, the local public health directors to feed us data so we know, not only so we have a sense of what kind of volume we're talking about, but to know how to best concentrate the help that we can provide.
Okay. It is, and I was shocked when I learned this, that it's still completely voluntary for states to share any data on monkeypox with the CDC. That's not the case with all diseases and all viruses. There are some that are mandatory in terms of reporting. Should this be mandatory?
Poppy, actually, most of the time we can't require the states to do this. On COVID, until we declared a public health emergency and started to enact these emergency authorities, we could not require states to provide us data. We need these states to help us understand the scope and depth of the problem, because we have vaccines and we have treatments, and we want to make sure we're sending them where they're most needed.
So why not? The WHO over the weekend declared monkeypox a public health emergency globally. The U.S. hasn't done that yet. You just listed one major benefit in terms of getting data that you would gain the authority to impose should you declare it a public health emergency in the United States. Why not do that now?
We're monitoring, and we've kept in close touch with the WHO. We're doing what we can. We're in a far better place than most of the world because we prepared. We had vaccines available before May 18th when the first case of monkeypox was reported in the U.S. We need to have more cooperation from the locals so we can get the information we need. But we've prepared in terms of the testing, the vaccines, and the treatment, but even that can be overwhelmed if we're not careful.
And you know, right here in New York City, the mayor, Eric Adams, has been pleading for more vaccine for weeks now. I understand you say we're monitoring, but the reality is you have the power now to declare this a public health emergency in the United States. It would give you the authority to get more data. And you just told me a few minutes ago your concern level about monkeypox spread is a 10 out of 10. So what are you monitoring for?
Well, Poppy, I sense that you're a vote in favor of declaring a public health emergency, but there are a lot of things that go into it.
I have actually no expertise in that. I'm just asking you what I think someone sitting at the couch at home would be wondering is, you're worried, why not make this declaration? Are there things that are holding you back from doing it that you're seeing that we don't see?
Because we declare public health emergencies based on the data and the science, not on our worries. We try to prepare for things. And so our scientists, as with COVID, are making decisions as we speak. As I said, if we were in a position, as most countries in the world are, to not have any vaccines for monkeypox, to not be having the testing available, we have capacity to test some 60 to 80,000 people on a weekly basis. We've only had so far reported about 3,000 cases. So we have done what we need to prepare. We just have to coordinate better with the locals so we can make sure we're feeding each other the right information. You mentioned New York City. We want to make sure we're helping New York City. They've received more vaccines than any other city in America, but we have to make sure that we're distributing in a way that prevents other jurisdictions from seeing what we see right now in New York City.
Right. You bring up other jurisdictions. So Illinois Governor J.B. Pritzker has called on you specifically to take more aggressive steps to counter the monkeypox outbreak. San Francisco's city supervisor, Raphael Mandelman, is quoted in the LA Times this morning saying this should have been a preventable public health crisis. Would monkeypox have received a stronger response, he writes, if it were not primarily affecting queer folks? I wonder what you say to that concern.
Well, what I can simply say is that there is no other place in the world where they have 300,000 doses of vaccines that they have distributed to the states as we have here in America. There is no other place in the world that has prepared the type of treatments that are available for monkeypox the way the U.S. has. What I can say is that we all know what it takes, those who are knowledgeable about monkeypox, to prevent this, and we need everyone to help. This is not COVID in the sense that it is not as contagious, but it is something that you can contract. Close contact means you're putting yourself at risk of contracting monkeypox. And so we need help from those who are in those vulnerable groups that might catch it. We need help from the locals so they can coordinate better with us because they don't have vaccines. And what we can do is work with them, but we need information, data, so we're doing this the right way to protect all Americans.
Specifically, what help are you asking for those who are most vulnerable right now? That is men around the average age of 36, men who have sex with men. What are you calling on folks in the most vulnerable groups to do?
We've been working closely, and we thank the LGBTQ plus community for the help that they provided in getting information and education out there to the communities of what monkeypox is, what it looks like, what it would take to contract it, and what you should do if you think you may have. And so all that information helps. They would then report to their local public health officials. We need those local public health officials to coordinate far more with us so we have the data that helps us drive our support where it's needed most.
And Secretary Becerra, I'd be remiss not to also ask you about a very important day, which is tomorrow, marking the anniversary of the American with Disabilities Act. The American Association of People with Disabilities put out a statement marking last year's anniversary, and they say, look, it's important to honor these anniversaries, but more needs to be done. Specifically, they're calling for more focus on identity and empowering people with disabilities to lead, accessible and equitable transportation, housing, employment, removing barriers to political participation. When I think of New York City, I think, we've got 126 of our 472 subway stations that are actually accessible for folks. So as we celebrate this anniversary tomorrow, what more needs to be done?
Well, as you just said, Poppy, the most important thing is when I remember as a kid growing up, you could walk to the door of that retail establishment, and I could walk in, but someone who was disabled might not be able to. And what we're trying to do with the Americans with Disabilities Act is say no one will be left out. Everyone will be included. And we've had now 3 decades of it's working. We still have more to do, but by God, we're getting to the point where everyone in America will be included. We talk about race, color, and so forth, disability as well. We want to make sure every American counts, and the ADA is there to make sure that we enforce the law against discrimination.
Secretary Xavier Becerra, thank you very much for answering so many of these critical questions and for the work you guys are doing on this front. We'll talk to you soon.
Thank you.